Hi, Dr. John here from NBC News on this Facebook Live, our Daily Doc series where I cover headlines you've probably heard over the last few days, maybe the last week, and get in behind those headlines, dig down deeper to find out what exactly the message is there and what you can do at home to make sure you, your loved ones, your family, your community stay as safe as possible and we get this pandemic under control as soon as we possibly can. And then I answer questions. So if you have questions, please send them our way. You always have fantastic questions. I love answering them. So if you have any, please, again, send them. We'll get them to them in the second half of this. But let's start with the headlines. I usually cover 3 of them, and there's 3 today as well. Number 1, testing. Now, there's a couple issues on testing. One, you might have heard about a new test that just came out. It just got emergency use authorization. And first, I want to take a little bit of a step back and describe the difference between FDA approval and FDA emergency use authorization. The difference between their approval and the authorization of these tests. Approval means it's gone through rigorous testing, it's gone through clinical trials, it's gone through human trials, it's gone through all the phases of testing to make sure it's safe and it's effective, and particularly it's different than something that might already be out there. That is a very, very long process. And so you can imagine in the middle of something like this, in the middle of an emergency, in the middle of a pandemic, it's hard to do that because that takes years, sometimes a decade to do. And so what they put in place instead is what's called an EUA, Emergency Use Authorization. And what that says is that we're looking at these certain things, in this case a test, sometimes it's a drug, sometimes it's a vaccine, but they look at these and they say, it looks like it's safe, first and foremost. It looks like it could be effective, although we're not entirely sure, but we're getting hints that it's effective. We don't have time to do the full detail because people are having issues right now. So let's give it this emergency use authorization. It's a temporary authorization while we're in the midst of the emergency, and then they keep studying it as time goes on. Again, the reason they're doing this is because it's needed badly, it looks like it's safe, and it gives some hints towards effectiveness. In other words, the studies so far haven't shown that it's a failure, that it looks like it's being effective. Well, they just did a new emergency use authorization for a test that you might see any time now because they're starting to, again, they just got the authorization. The company Abbott is starting to make them and get them out there. They think they'll have tens of millions of these, according to them, in September, and 50 million of these tests in October. So why is this different? What makes this unique among the other tests? Well, first and foremost, there are a variety of tests out there. There are what we call diagnostic tests, and these are tests you use to find out if you have an active coronavirus infection right now. The SARS-CoV-2, COVID-19. If you have that infection right now, you get a diagnostic test. The other types of tests are antibody tests. Antibody tests tell us if you've had infection in the past and you've built up antibodies that possibly could give you protection, at least a limited time basis, from getting coronavirus again, although we'll bring that point up in another headline I want to talk about. In the diagnostic tests, there's 2 different kinds. PCR tests, which are called molecular tests, are basically the gold standard of the testing because they get the actual RNA from the virus, they amplify it, and they look at it to see if the virus is there. This is showing them essentially an active virus, or at least most of the virus parts that are in there. That is the test. It's a nasal swab, a throat swab. There's some saliva tests as well. It gets sent to a lab that's a bit more sophisticated, has specialized lab equipment, specialized what are called reagents, chemicals to amplify that RNA so it can be detected, and then it gets done that way. That's why it takes so long to do. And usually we're talking days, 2, 3, 4 days, up to 17, 22 days I've heard of. And that has become an issue because obviously, we try to get these tests as soon as possible so we can do something actionable with the tests. We can tell you have it, you don't have it, you need to quarantine, you need to stay in quarantine, which if you're getting tested, you should stay in quarantine until that test result comes back because you're getting tested for a reason you think you might have coronavirus. But besides that, it takes a while to get back, so that impacts people's lives. So what we've tried to do is get quicker tests. Some of those quicker tests are what are called antigen tests. The difference here is the antigen test only detects proteins from the virus itself. So it's parts of the virus, might not be the active virus, and those aren't as sensitive in telling us whether you have an active infection, and sometimes they can be missed. So these antigen tests aren't as accurate as the PCR tests. So that's first and foremost to know that. Now on these antigen tests, some of those have taken a while because they too take sophisticated equipment. Well, Abbott just developed one. It's called Binax Now. Just got this EUA, this emergency use authorization. And it's a test that can be done in a doctor's office. If you've ever gone to your doctor's office and you've gotten a rapid strep test or a rapid flu test, or you have a kid who's gotten a rapid RSV test, that's almost exactly what this is, because essentially it's a test that uses a little card. So what they'll do is they'll take a swab in your nose, a nasal swab. They'll take that swab, insert it into the card. There's a little slot underneath. They'll put a reagent, a chemical that comes in, looks like an eyedropper bottle, onto the card, and then they'll time it for 15 minutes. At the end of 15 minutes, they'll look to see if there's a stripe on it. If there's a colored stripe, that means that you have coronavirus. And the way they make sure that card still works is there's a second stripe that is called the control stripe. That control stripe has to be on there regardless of what the rest of the test shows, because that shows that that card is valid, it's working like they want it to work. So you get that control stripe, forget about that for a minute, you're looking for the other stripe. If you get the other stripe showing that you have the infection, then usually what I do is I take the card back into the room and I show the patient, look, you can tell by the stripe here that you have coronavirus. Or you can tell by the fact there's no stripe here, you don't have coronavirus, at least according to this test. But again, this is where it comes into play because these tests aren't as accurate as the other ones. And so often do this. If you come in, and you might have had this happen, you go to your doctor's office, you think you have strep throat, they say, let's take a couple swabs. One swab, they do the quick test, like we're talking about here. They come back and say, okay, this is negative, but all your signs look like you have strep throat. So I'm going to send this other swab in to get the more sophisticated test. And so the same thing might happen here in coronavirus. And my guess is the CDC will come out with an algorithm saying, if you get a negative but you suspect it, send the PCR test in to complement that and to check that, to double check it, and in the meanwhile stay under quarantine. So that's a test that's coming out. The good news on number one, it's fast. It takes 15 minutes. It's easy to do, so the doctor doesn't necessarily have to do it. Staff members can do it. And I can envision a time when they go to schools, they go to workplaces, they go to nursing homes, jails, there's different areas, and test everybody in there on a regular basis to find out what's going on. It's a screening type test. And then if they get a negative or a positive, then they do what they need to do at that point. And it's also inexpensive. They're saying around $5 for a test. And so, again, this is really going to help push things forward. They're saying tens of millions of tests in September. We're not quite sure what tens of millions mean. But then 50 million by October, these tests are going to be in the doctor's offices. So don't be surprised if you go to your doctor's office, you go to emergency room, and they say, yeah, let's go ahead and test you here. Come back 15 minutes later. Looks like you're positive or negative, and go from there. So that's good news in the testing front. Now, overall, looking at cases across the country, and here in the U.S. right now, 5.9 million cases, unfortunately 182,000 deaths, and so those numbers are rising. But the good news is those numbers also seem to be declining here in the U.S., at least on an overall basis. There are some hotspot areas, but right now, since August 16th, we've been under 50,000 cases a day. So that's good because if you remember at one point, we were creeping up 60, 70,000 cases a day. Now, and there was thoughts that we'd get close to 100,000 cases a day and keep going. Well, the cases are under control. They think this is happening for a couple reasons. One, they think it's happening because people are wearing masks. And that's important to understand because those masks can help people. And I was actually talking to a doctor, Joseph Allen. He's a professor out of Harvard that studies ventilation and buildings, particularly building ventilation and filtration. And what he told me was interesting. He said if you look at masks, which he has studied them and looked into them, is masks themselves, let's say it's 50% protective. N95 is 95% protective from those particles. Let's say it's 50%. And a lot of people say, well, it's 50%, why should I bother? Well, you can imagine, as he puts it, if I have one that's on 50%, the person next to me has one that's on at 50%, statistically, that's going to give you about a 75% protection. And so that's pretty good protection. We're getting up there. And the more protective these are, and a lot of these masks are 60 or 70% protective. So if everybody's wearing them, we protect everybody else. And that's an important point to understand. Now, putting it in a bit of perspective, testing, yes, has gone down in certain areas. Part of that's because they're not hotspots anymore. Part of it is because testing has gone down for a variety of reasons, either logistical or manpower-wise. And so since we're testing less, we're finding out less as well. And so you have to put that into that equation as well. Interestingly, around the world, some of the places that are calmed down, particularly Europe, is having issues with cases popping up, having outbreaks, and having to shut things down that they had opened up initially. And then India, which was catching up to us, is now 75,000 cases a day. And so they surpassed us at least in the number of cases per day, not in the total overall cases as of yet. And so again, wearing those masks is important. keep doing that. We're getting it under control. We're sliding down that scale of how many cases we're having a day. The concern is when we start getting into our cold months and coronavirus becomes more active, we go indoors, we could potentially spread it more. We want to be careful. And that's why the recommendations, and I highly recommend it to you, to get your flu shot so you don't have to worry about that on top of worrying about coronavirus. You can at least protect yourself from what we have protections for as of now. And then the third thing you want to talk about, reinfections. And you might have heard about this, about certain cases of reinfection occurring around the world. Now, putting this into perspective, we've been talking about possible reinfections over the last few months, and the concern has been, okay, what if we see cases crop up of where people catch it, get better, and then catch it again? Does that mean the virus is changing, the virus is mutating, and all of a sudden we're going to have this mutant virus floating around the world and everybody's going to get sick all over again? No, that's not the scenario that typically plays out in situations like this. Now, you need to understand the coronavirus, like any virus, is constantly changing. But these changes are just a little bit of changes on the outside spikes or the envelope of the virus itself. These changes to the outside structure of the virus and not necessarily to the integrity or the makeup of the whole virus. That's when those mutations are what we call significant mutations, where it becomes a different virus strain and we get very concerned about it. But in this case, these look like they're small mutations, but enough to where a person, and at least in these very rare number of cases, have gotten reinfected after being infected once, and their antibodies only protected them to a certain amount, and I'll explain that in a minute. But putting it in number perspectives, right now there's a gentleman in Hong Kong that got reinfected after months. There's a person in Belgium, a gentleman in the Netherlands, and then one here in the U.S. A few differences. Number one, the one in Hong Kong had absolutely no symptoms, was sick the first time and no symptoms the second time. And so what researchers are saying, and it's the same for the person in Belgium, researchers are saying, okay, this shows us that antibodies are working a lot like vaccines work, where it might not protect you from getting it, but it protects you from getting sick or critically sick because of it. And that's what we're seeing in some of these cases. Now, the person in the Netherlands was an elder gentleman who had immune system compromises, and so he's in a different category from the other two. But the United States one, let's look at that one, because this one was in Nevada, got coronavirus, recovered a few months later, ended up getting coronavirus again. The first time was very mildly symptomatic. The second time ended up in the hospital on oxygen, a lot more symptoms, a lot more complications from coronavirus. And so this is showing that it doesn't necessarily work the way it's working in the other gentleman. Could be a few reasons behind this. First and foremost, right now in the world, 24 million cases of coronavirus around the world. So far, we've had four cases of people who we know have gotten reinfections with coronavirus. The other ones you've heard about aren't true reinfections. In other words, they didn't find another virus. They just found these virus parts, and that's why they were getting positive on the tests that we do, the PCR tests in particular. But the ones who did have true reinfections, we think that number is 4 as of right now. Now, part of the issue is you're hearing about these things that typically end up happening in the scientific community, but we don't really hear about them in the outside world because, again, 4 out of 24 million doesn't bring a lot of attention. But the reason you're hearing about it now is because there's so much attention being paid to coronavirus. But it does show a couple of things. One, experts I talk to say, I would be surprised if we didn't get reinfection rates, especially on this limited number of people. The thing to look for, what happens with these numbers? Do they grow or do they still stay limited? Obviously, if they stay limited, it's not that huge of an issue. It's something we expect and it's something to be followed. If they grow, then that gets more concerning. Fast forwarding, what does this mean for the vaccine? We still don't know at this point because, at least in these individuals, antibodies didn't protect them from getting that reinfection. But again, these are extremely rare cases. Doesn't mean the vaccine won't protect us for long periods of time. But what we still don't know when the coronavirus vaccine comes out, is it going to be a yearly vaccine, a vaccine we need every 10 years? We don't know at this point. Time will tell with that one. But hopefully, I, like everybody else, hopes it's one of those vaccines you get once or twice in your lifetime, and that's all we really need. But again, a lot of people got concerned, a lot of people got anxious about the fact that we had these 4 reinfections. Remember, it's 4 out of 24 million. Looking at it very closely, typically not something you hear about, but since so much attention is being paid on coronavirus, it's out in the headlines and it's out in the media right now. But what this means is it's taking the natural course of progression of viruses and what typically happens with viruses. But we do expect people to get reinfected in a very, very limited number of cases. We'll keep an eye out to see if those cases increase. If they do, then that's a different concern altogether and something that will definitely be looked at as well. So again, talking about a few headlines. Testing, number one, new testings are coming out that are going to be faster at your doctor's office and can be very helpful. Number two, cases Overall declining here in the U.S. We're under 50,000 since August 16th every day, which is good news. Other parts of the world are seeing increases. In parts of the states here, we're seeing little outbreaks as well, so we want to be careful with those. And we think the main reason behind the cases declining here because people are adhering to mask wearing. And then reinfection. Yes, there have been a few cases of reinfection. Again, very, very rare. Keeping a close eye on it. Time will tell what it actually means for the rest of us. Let me see if you have any questions.
When are you not contagious anymore?
So the question is, when are you not contagious anymore? Well, what the CDC says, if you have coronavirus and you've had symptoms, you're symptom-free after 10 days, you're okay to go out, you're no longer contagious as long as you've been fever-free for 24 hours. But if you still have symptoms, particularly if you still have fevers, then you need to be careful because that means you're still potentially contagious. Now, the concern is not so much once you have the symptoms and become contagious, the concern is the 40% of people plus that we know of that can have no symptoms, can be asymptomatic, and can still have the virus and spread it to other people. And that's why we're saying, regardless if you've gotten coronavirus and recovered, regardless if you haven't gotten it, everybody should be wearing a mask because we need to protect everybody else from us. Number one, we don't know if you have it, even if you don't have symptoms, because 40% of people don't have symptoms and have coronavirus. Number two, you could certainly spread it beyond that 10-day period and not even know it, although the 10 days seems to be the average one for getting people not to be contagious anymore. And the antibodies, we don't know how long they're going to protect you. So again, wearing masks, important for everybody.
Were people who died tested post-mortem for COVID-19?
Were people who died tested post-mortem for COVID-19? In most cases, no, because people were tested while they were still alive and fighting for their life, and they tested positive for COVID-19, so there's no need to retest them. Some people they have tested after the fact that weren't, especially at the beginning of the outbreak, and weren't necessarily tested for COVID-19 and found out that they did, in fact, have COVID-19 at that point. The virus, you have to remember, does not live very long outside the human body and doesn't live very long in a non-living human body. So getting that testing would be very difficult long term. And so as far as going back, people that might have died 6-8 months ago, that would be difficult to do. But for the most part, they test them while they're alive, and there's no need to test them afterwards.
Do you need to clean all of your supermarket purchases?
So the question is, do you need to clean all your supermarket purchases? Well, first and foremost, you should be cleaning them anyway. I think you're talking about the fruits and vegetables that you have. They should be clean anyway. What you want to do is just simply rinse them off. You don't really want to use soap because that soap is hard to get out of there and it could upset your stomach. There are specialized cleaning products. The USDA says you don't really need those. You can just do water and rinse them off like we normally do. But make sure you practice good food hygiene. Use different cutting boards for the fruits and vegetables than you do for the meats. In particular, make sure your meats are heated to the appropriate temperature so you don't get sick from other types of foodborne illnesses as well. But as far as the other types of things you get from the grocery stores, the cartons, the packaging, those types of things, when coronavirus first came out, the message was, pretty much wipe down anything you can think of and just keep wiping stuff down. But now we know, even though it might last a while on those surfaces, it doesn't really get that much on those surfaces and it doesn't really transfer that much to us. So the better thing to do is not to necessarily wipe everything down, but just make sure you wash your hands after you put them away. When you pull them out, make sure you wash your hands before you prepare them. Hand washing is a bigger important part than actually cleaning all those different products.
Is COVID-19 a virus or a disease? What's the difference in the two as it relates to COVID-19?
Actually, this is a good subtle question. Is COVID-19 a virus or a disease? It's a disease. COVID-19 is a disease. It's a disease that's caused by the virus SARS-CoV-2. SARS-CoV-2 stands for Sudden Acute Respiratory Syndrome Coronavirus 2 because we had a SARS-1, which was just called SARS, back in 2002, 2003, and this is very similar to that. And so very astute question here. SARS-CoV-2 causes the disease COVID-19. And one way to think about it is looking at HIV/AIDS. AIDS is the disease. It's caused by the HIV virus. So HIV virus causes AIDS. SARS-CoV-2, which is not related at all to HIV, causes COVID-19, just using that as an example.
Why are people asymptomatic but positive for COVID? It makes no sense.
So the question is, why are people asymptomatic but positive for COVID? And this is the way viruses work, and sometimes bacteria works. This is the way germs work. So once we get these inside our body, we all react differently to it. So some people, their immune system's able to fight it off enough to where they're not showing any symptoms. It's not really taking a foothold in their body. Even though it is multiplying, it's not really getting to the point where they're starting to have symptoms. But it is getting to the point where they're still breathing it out through their mouth, through their nose, and they're still getting it out into the environment. So even though they don't have symptoms, they still have the virus, they still have COVID-19, the disease, but they don't necessarily have the symptoms associated with it. And sometimes we call these subclinical symptoms, where they might feel a little under the weather and they don't know if they have symptoms just because they feel a little achy and maybe related to I didn't sleep very well, or my pillow wasn't very good last night, so my neck hurts a little bit. But regardless, people that don't have symptoms, we know 40% of them, 40% of the people who have COVID-19 don't have symptoms, and they can still spread it.
Why do COVID-19 side effects last so long?
Why do COVID-19 side effects last so long? That is a question that researchers across the globe are trying to get a good handle on. There's a support group here in the U.S. called the Long Haulers, and they basically are supporting each other through what they call these long hauler syndromes. And these syndromes are many different types. People talk about losing their hair. They talk about fatigue that just goes on for months, kind of a chronic fatigue syndrome type issue. They talk about a variety of aches and pains that just continue to go on, and to the point where sometimes it's so far after the fact, or they never in fact tested positive for COVID-19 because they didn't really have any symptoms, but they still come up with these months later, that they go to their doctor, and their doctors are having a hard time putting their finger on exactly what is happening. We don't know why that's happening, but it's not typically happening because of the virus itself, but the body's reaction to the virus, and in particular the immune system's reaction to the virus. Anytime we get what we call a novel virus, our body is naive to that virus. It's never seen something like that before, which is what's happening with SARS-CoV-2 and COVID-19, is our body doesn't really know how to react to it. So it takes a while. It gets a foothold in our bodies because it takes a while for our immune system to recognize that it's something it needs to get rid of. And then once it does, instead of like a lot of things we've had in the past, flu being a good example, since we've all been exposed to flu at some point, or flu vaccines over the years, we have a built-up small immunity to it, which means that once it hits our body, our immune system at least understands, okay, I'm not exactly sure what kind of flu this is, but I know it's a flu, so let's get our flu armament out there and start fighting this virus. With this SARS-CoV-2, our body hasn't seen it, so it doesn't really know how to fight it. It doesn't really know what to throw out there. So what it does is it throws everything out there, everything including the kitchen sink, to try and fight it, which puts our immune system into overdrive, which causes it to fight other things as well, including our own body. And that can happen for long-term periods. And that's why you're seeing people who recover from COVID-19 and then start getting these long-haul syndromes later on, because their immune system is still fighting their body. It doesn't know how to calm down after this infection. Once our bodies get used to COVID-19 around the world, the SARS-CoV-2 virus, then it's going to have a better understanding of how to do that. And now one thing we're finding out too is people who've been exposed to coronaviruses, other than this one, because there's other coronaviruses out there that cause the common cold, that they look like they might be able to fight off this SARS-CoV-2 virus a little better than people who have not been exposed. And so that's giving us some hope that over time we'll get a better grasp on our bodies, will get a better understanding, our immune systems will get better abilities to fight this. But a couple things have to happen. Number one, herd immunity, which means either a lot of people get sick with COVID-19, which hopefully not, or the vaccine, which means people get vaccinated, we get enough people out there, and so then we have a better chance of fighting this off both individually and as a community. But fantastic questions as always. Love answering them. You guys always come up with really great ones. And the headlines for today, again, testing. There's a new test coming out, should be out shortly to your doctor's office, that you can get a 15-minute coronavirus test very inexpensively, and it can give you a good idea of whether you have it or don't. Again, not as sensitive as some of the tests that take longer, but certainly a good, useful tool to try and figure out who has it and keep them separated from everybody else. Cases, they're on a decline. They've been going down since August 16th. We've been under 50,000 cases a day in the U.S. Obviously, you want to get that even lower. One of the reasons we think this is happening is because people are actually wearing masks and adhering to mask policies. And then reinfection. There's been 4 cases out of 24 plus million cases of coronavirus in the world. There have been 4 cases of true reinfection, meaning they got reinfected the second time after they recovered from coronavirus with a coronavirus that changed a little bit. But again, putting in perspective, it's 4 out of 24 million. And so this is more interest at a research level at this point than it is at a level of us getting too concerned about it, but something certainly worth keeping your eye on. So thank you very much. I hope you have a fantastic weekend. And first and foremost, and I also hope that you, your family, your loved ones, your community all stay happy and all stay healthy. Thanks.